Welcome, Dr. Wong. Today's conversation is part of our series that we're building called Build What Matters, where we're connecting with leaders that are bringing value to the FQHCs, the sector that we work with. So thank you for being here. I wanted to start off maybe, tell us a little bit about yourself, how you ended up doing the work that you're doing, what led you to Direct Derm. Give us a little bit of background on how you started this whole venture.
Hi, Alex. Thank you for having me. I'm David Wong. I'm a board certified dermatologist, been practicing for over 20 years. I'm also a clinical associate professor at Stanford in the Department of Dermatology. I'm the founder and CEO of Direct Derm. Direct Derm was founded really to address the access gaps in medical dermatology care in our communities. As you probably know, patients unfortunately have to wait typically many months to get in to see a medical dermatologist, which can have, unfortunately, negative impact on patient outcomes there. And so the idea behind Direct Derm was really to really think differently about how we could deliver care more efficiently and better so that patients get timely care, and do it in a way that's sustainable and scalable for our healthcare system.
Yeah. One of the things that has stood out to me ever since we met, which was over, it's been, I don't know, maybe we're going close on a year and a half, 2 years, is that the way you guys have built Direct Derm is you provide this unique service where I want to jump into in a little bit, but you've also have like a really big focus on FQHCs, where a lot of dermatology groups don't. So why do you work with the FQHCs? What drives that focus?
Yeah, I think, it goes back to why I went into medicine is really to help, patients that are in need. And that's the beauty of the profession that I'm fortunate to be able to do every day is really to impact where our communities need me and dermatologists the most. And, FQHCs are important organizational system throughout our country that really helps populations in need. And so when we first thought about this, over a decade ago now, about where to make an impact, I first partnered with FQHC and FQHC lookalikes because speaking with them, they expressed the real challenges they have every day for their patients and their providers there about the lack of support from medical dermatologists. That's impossible to get access to a dermatologist. And, the opportunity at that time to think about innovative ways in which we could bridge that gap really sort of started the direction that, and the idea behind Direct Derm. It started with simply, with a few FQHCs and FQHC lookalikes that we partnered with, and we started initial pilot and program in which we connected their providers with our board certified dermatologists, where, anytime a patient came in now that had some dermatologic skin issue, instead of sending a referral and not being sure if the patient even was able to get in, and even if they did, it was 6 months later, they could connect with us, provide a picture of that rash or the growth on the skin, and our dermatologist would provide immediate diagnosis and treatment recommendations back to that provider. And it was amazing. The feedback we got is it really transformed the care that patients in that community could obtain. Patients couldn't believe that they even had access to a dermatologist. They didn't even think that dermatology was even available. And so it all started there. And, from there, and the partnerships with FQHCs, and just seeing that impact we made on, just 1, 2 patients in the beginning that has gone to, thousands and hundreds of thousands. It's where Direct Derm has continued to focus because of the impact that it can make every day.
Now, your motto is different, right? Because I know when I first heard about Direct Derm, I thought it was just telederm, but it's not, right? So can you talk a little bit about the overall model of Direct Derm, the full scope of what you guys do?
Yeah, I think what we learned as I just spoke about is telederm has been a really important piece and modality of care to help bridge that gap. And really, telederm is just a modality, right? It's just a way in which we can help bridge that gap using technology. But with dermatology, I think the power of teledermatology, because again, dermatology is so visual based, right? How dermatologists are trained to make diagnoses is through pattern recognition. That's a patient comes into one of our clinics. We are looking at their skin, visually inspecting that pattern of that rash or the growth. And so now with imaging technology in our hands, I mean, everyone's hands, providers and FQHC can take pictures of those skin issues, and immediately a dermatologist can provide diagnosis and treatment recommendations, which allows several things. Number one, it allows us to immediately treat that patient. For example, they have atopic dermatitis or eczema, really common rash, or something more unusual. We can diagnose and treat immediately. What we can also do there is identify patients that have something more urgent that needs to have some intervention. And so it helps us triage things that are more urgent versus things that are less urgent, and identify those patients that actually need an in-person appointment or in-person procedure. So in dermatology, a lot of what we do is, treatment with medications, which we can do completely virtually. And I would say over 80% of the patients we see, we can manage that way. But what teledermatology allows us to do is immediately triage and identify those patients that need something beyond just a prescription. For example, need a procedure like a biopsy or something like that. So we, in working with FQHCs and understanding the needs that they don't only have the need, their patients and provider need support in diagnosis and treatment for patients who can be seen virtually, but also support for those patients that actually need procedures. For example, a growth that might be skin, we're concerning that's skin cancer. So we support FQHCs in helping them do, is ideal, procedures there where we can support their providers so that those patients can stay in their medical home where they're familiar with and keep them in their medical home. And we can help support those providers there with whether to biopsy and help interpret the pathology report when the biopsy comes back and help guide that care. But in addition, we also have found that, some things will fall out of the scope of even, providers at an FQHC. And so some patients do need to be seen in person, and that's critical. We don't want to leave after, seeing them through teledermatology. They're still waiting for 6 months to get in. And so we also have clinics in Northern and Central California, and that's growing with locations where we have providers that can see those patients and we can seamlessly schedule them in. So really, in dermatology, what we found is, offering that hybrid of a robust telemedicine program with the support of the FQHCs and the providers to do procedures in at their location, but also supplement that and support in-person care when needed locally is really critical to really fill that access gap and provide the type of outcomes that we're seeing for these patients.
So it's a very unique model, right? Because it's not just telederm. You guys have clinics in certain parts of California, but I know I've used your services. I live in Vegas, and getting to a dermatologist here was I went to a doctor and I had like a real bad dryness around my eye, and I talked to a doctor and they said, okay, well, we're gonna refer you to a dermatologist. And that was like a few months out, and when I went there, it was gone. And they said, oh well, come back when you have it again. And it was very challenging, right? Because it's like, okay, now I have to wait to see if I get it. And when I did get it, again, there was a long wait before I could get back in there. That was just a little simple dryness around my eyes. And thanks to you, I was able to get medication. We had a consult. You prescribed the medication. I was able to get the medication, and it's been solved ever since. But what about when there's a more serious condition and someone goes to their PCP, whether it's at an FQ or not, and then they say, well, okay, we're going to send you to a specialist, not direct derm, someone else, and there's a long wait. I mean, what are some of those conditions that someone could have that they get referred out? They're really serious, but now you have to sit there and wait, right? Like, I mean, what's a better way to solve for those challenges?
Yeah, I think, you bring up an important challenge that the patients in the community are facing exactly is, it's very difficult in dermatology to get care when patients need it, when and where they need it exactly. And some of these things are urgent, like I mentioned, and critical, right? examples, for example, are, for example, skin cancer people think about, right? So certain types of skin cancer are very aggressive. And so unfortunately, I think before starting Direct Derm, I had, these unfortunate experiences in my clinics when I was, helping to support some of the Central California area. Patients would come in that, had what unfortunately turned out to be melanoma. But unfortunately, they came in. It took them years to come in, and multiple reasons, but a lot of it's because of really poor access. And unfortunately, they passed away because of that. And so, there just has to be a better way, as you're pointing out. We need to be able to provide care when and where patients need it. And so, I think that's the importance of having different modalities and really leveraging telemedicine and in-person care really effectively. And that's what we've tried to do and are doing here at Direct Derm, is that, because exactly, you see a growth that suddenly is changing. You don't want to be sitting on a wait list and that anxiety and by the time you get in, perhaps, it's, too late. And so, you want to be able to access a dermatologist. And now with Direct Derm, patients and their providers can access us immediately. You take a picture, you see that thing changing, you take a picture, send it over to us, and immediately we will assess whether it's something of concern or not. And if it is concerning for a skin cancer, we can get you either biopsied at, for example, that FQHC, or scheduled into our appointment without delay. And so it's critical. And it's not just, skin cancers. I mean, we see, rashes where somebody has, a very serious rash. And so, for example, a lot of, for example, herpes zoster, shingles, and a lot of our older patients, timely, where it's important to intervene very quickly, diagnose it immediately, get them on antivirals to decrease the chance of post-herpetic neuralgia or other sequelae because of it. Serious drug reactions where patients have, where, it can be life-threatening, where, there are skin conditions and drug reactions where their skin can just completely blister off, and it can be a medical emergency. All of medicine, we strive to get patients care when and where they need it. In dermatology, it's just so challenging. And the challenge is,
Mhm.
by the time you get into the dermatologist, it's not the time you have it, just like in your
Right.
case, right?
Yeah.
So now when you have it, you can immediately connect with the dermatologist when you actually have it, and not wait and hope. A lot of patients come into, I think a lot of dermatology practice know this. A lot of patients just show up and they're like, "Oh, doctor, I came in anyway. I don't have it right now, but it took so long to get in. I didn't want to miss my appointment." And it's like, well, we'll have to try to reschedule you when you have it. And so again, in-person care, there's certain things you will never replace with in-person
Yeah.
care, right? You can't do certain
Sure.
procedures or certain things, but there's some things that if without telemedicine, you can't provide to these patients. You can't provide them sometimes with that immediate timely care. You can't catch things when it's active. And so I think it's so important to be able to provide these different modalities of care so that patients, again, get care when and where they need it.
It's following up on that, my situation where I did go back and I was like, well, I don't have it. Right. And the dermatologist was like, well, let's, if it happens again, come back. And their, their next approach was, well, we have all these other services. And now they were trying to like promote all these other cosmetic services that they have at the. But I was one of those people. I didn't want to miss an appointment because I had to wait months to get it. Even though my rash was gone, my dryness was gone, I still went. Right. I should have known better being in the industry, but I still did it. One of the things that in the work that we do with FQHCs that we always hear from patients is just for patients that have Medicaid, in California, Medi-Cal. I think there's always been some sort of what's the word I'm looking for here? There's some sort of stigma that goes along with it, right? Like, oh, you have Medi-Cal or you have Medicaid, right? And I remember growing up, I never had any sort of health insurance, not even Medicaid, but it was almost embarrassing to have it, right? So that was one challenge. And then when you do have it, it's finding actual providers that actually take it. right? And harder is to actually find specialists that are good that take it. You guys are great, and you guys take, if not all, most Medi-Cal, you guys are contracted with most Medi-Cal, Medicaid contracts. So a patient, gets great service, that they have Medicaid, they can do it from the comfort of their home, right? But my question to you is, what drove you guys to make that decision to say, hey, we're not only going to work in the private sector where most specialists like to live, you actually decided to service the Medicaid population. Why?
Yeah, I mean, I think it goes back to really, the mission of at Direct Derm, and why we started Direct Derm was really to fill where the need is in our community. And just like you pointed out, where's the need? The need's greatest in patients with Medicaid. And a lot of that is, unfortunately, most of the medical dermatology practices, or dermatology practices in general, don't take Medicaid. Because of the financial incentives. Unfortunately, a lot of our dermatology practices are so busy that they exclude and won't see Medicaid. So so when we started Direct Derm, again, that was the whole goal, is really to serve the populations in need and really provide the quality of care, the same quality of care for all, no matter what, if you're uninsured or have Medicaid, have Medicare, have commercial insurance, we treat patients all the same. Our goal is to provide a sustainable service for all individuals. And so, I think that was what unique, and what was exciting about Direct Derm is how can you create a medical dermatology practice that can serve all populations and do it efficiently. And so I think, I think it was a tall goal, I guess, at the time, right? Of, serving, all populations, and at the same time transforming so that patients can be seen immediately, right? When they need it again. But, that's, I think setting those goals really challenged us to really rethink the model in dermatology. And you know, uh, I think the partnerships we've had with the FQHCs are a big part of it, right? Is that it takes partnerships for this to happen for the communities, right? So I think a lot of this was the FQHCs that partnered with us and saw the vision and built this with us and did that. And so, we thank our partners and for, being a part of this and our ability to do this. But no, yeah, every day we make impact every day. I mean, I think you see the patients every day,
Oh
and
yeah.
that's what's satisfying about what we do is that just seeing every patient every day, just amazed at the kind of care that they can get with no matter what insurance they have.
What will you say? You talked about partnerships. What will you say to someone, let's say there's a FQHC executive, either, it could be a chief medical officer, a COO, or a provider, or someone that's in charge of referrals, what will you say to them on why they should consider partnering with DirectDerm?
Yeah, I think the important thing is to really appreciate, I think, the need that the community has. I think often people don't appreciate, again, and think about the dermatology specialty, you know, but, you know, over over 3 million patients are diagnosed with skin cancer a year. 1 in 5 Americans will develop, skin cancer by the age of 70. And the great thing is that, skin cancer is highly preventable. Over 90% are due to, sun exposure. So a lot of it is better education. And, skin cancer is highly curable if it's diagnosed early, like I said. So, having a really it's really important, I think, for our community and the health of our communities to have a really strong medical dermatology service for our community. And the wait times can have huge impacts on our outcomes, as I mentioned. And so, I think the great thing when we partner together, at Direct Derm, is we've really built it so it's part of the healthcare system. There's no cost to the FQHC to engage with us. We do it really efficiently, and ultimately, we are contracted with, as mentioned, Medicaid and most managed Medicaid plans. That's our goal, and we continue to be contracted. And we do that scalably and sustainably in California and multiple states across the country. So it's really a program that's really comprehensive when you think about what the support is, as we talked about earlier. It's not just telemedicine. It's telemedicine and in-person care. And we really think about that full support that patients need, whether it's something that can be treated over telemedicine or something that needs in-person care or needs a combination of both. We know that's critical in order to support our patients. And so FQHCs will find and partner with Direct Derm is really a comprehensive program that helps really support their patients' needs. Again, bringing care when and where patients need it.
Yeah. No, that makes sense. And I know you guys do a great job in following up with the patients, closing the referrals, making sure those patients are seen, and that that the FQHC actually knows what happens with those patients, and they have a full circle. So I think that's what makes a strong partnership. Dr. Wong, I want to be respectful of your time. You have a lot on your plate. As a closing question, our podcast here is called "Build What Matters." When you hear that, what does that mean to you? What does a "build what matter" mean to you?
Yeah, I mean, I think that's what it's all about. It's building what matters and what matters to our patients and our community, first of all. I mean, I think, we have a duty to our community to really, provide services that are important to them for their health and livelihood of themselves and their families. So it starts there. And I think Bill, what matters means also what matters overall to our in our healthcare system and the vision we're trying to provide for the overall health of our nation and the American people. And it has so in order to do that, it has to be we have to build things that are scalable and sustainable. A model that really has the resulting outcomes for our patients, but something that ultimately is more efficient and, saves money to our healthcare system. We have the ability to have the greatest healthcare system here in the US, and that's our duty. And so, I'm just glad Direct Derm is a part of that every day.
Awesome. Dr. Wong, thank you so much. We appreciate the work that you're doing. Thank you for everything that you do for the community, for the patients. We truly appreciate your time here today. Thank you.
Thanks, Alex. Appreciate the opportunity.
Yeah.